lot of times people will report of kind of quad tendon like aching tightness just along the scar. And then I would say one that's not listed on here, I think that some people don't regain full flexion, especially that like kind of like foot to their butt flexion because of just the quad graft. In this video, I'm going to be talking about the quad graft, going over the pros and the cons and the breakdown of the quad graft, and also explain sort of some anecdotal information that I've seen throughout the years. As I would say in the past 3 years or so, I've seen a lot more quad grafts recently. So I'm using an article to sort of cite some of the differences, using, again, research to dictate our decision-making process. This article is entitled Graft Selection in Contemporary ACL Reconstructions by Raphael et al. It was in 2021 in the Journal of American Academy of Orthopedic Surgeons. So the quad graft, obviously the scar is going to be more in the front of the leg. And some of the indications are in young athletic population, can both be skeletally mature or immature. They also, I would say, they will use this graft for athletes who rely more on their hamstrings. So essentially sprinters, they might not use the hamstring graft for them, but might use more the quad graft. Also, athletes or potentially adults who are more on their knees. So you think like a wrestler, maybe like a plumber, profession, that type of thing. Just because, again, we understand that patella tendon grafts, typically that can be one of the cons of a patella tendon graft. But since the scar is higher up, you don't really have that issue. Some of the complications for a quad tendon graft is prolonged quad weakness, particularly with full thickness grafts. Most of the surgeons that we deal with typically do partial thickness grafts, but I do see occasionally some that still do full thickness grafts. Also, some have donor site pain. I do think that I do agree with this. I do see a lot of times people will report of kind of quad tendon like aching tightness just along the scar. And then I would say one that's not listed on here, I think that some people don't regain full flexion, especially that like kind of like foot to their butt flexion because of just the quad graft. Most of them can get back like 90-95% of the range of motion, but that last little bit, sometimes people have struggled with that. Also, some of my quad grafts will report of like kind of consistent tightness in the quad. Again, you know, you're messing with the quad tendon, so that obviously will play a role in how your quad is. And, you know, for example, things like a Bulgarian split squat with the ACL leg and back with a quad graft, it gets really, really tough for my quad grafts. And then some of the pros, there's a less risk of infection compared to hamstrings, less risk for injury to the infrasaphenous branch, much lower percentage compared to the patella bone, the patella graft, lower donor site morbidity, and also less anterior knee pain, which we already talked about. And also can be harvested as minimally invasively harvested. Some of the cons, again, sort of that obviously goes in conjunction with the complications, is a post-operative hematoma, patella fracture with a bone block harvest, and rectus femoris retraction. Thankfully, I've never seen any of these three, but these are complications that the article had found. So yeah, you know, just I would say some of the things that we really work on, and I've tried to post more of this within the ACL Mastermind group. I think deep knee flexion loading is really, really important, more important compared to the other main grafts. You see me post things where like they are on in prone with a band or a strap, trying to pull that knee as far forward as possible, but also having them push against it, right, to try and work on that deep knee flexion. And even within a seated position, right, just have them working, if you're working with a ply box, having them work on deeper knee flexion extensions can be helpful as well. Again, just different positions to really get them. So I really like the prone one, just because you can't typically, as long as they cue them to keep their hip down, that you can't really compensate. And it can really show them how much knee flexion they're going into. And if you do a prone knee extension, that anchor has to come obviously above their head. So if they're laying on their stomach, again, if I'm prone, laying on my stomach, a little hard to do right here, but the anchor needs to come this way so I can kick into full extension that way. That one is extremely tough for my quad grafts, but again, I wouldn't necessarily do that with my hamstring or patella tendon graft. But I think for my quad grafts, I have to make them kind of be in that deeper knee flexion angle. I do think isometrics can be utilized earlier, especially knee flexion isos, again, in prone, supine, whatever, prone or seated. Just getting that quad working as much as possible is beneficial, especially for the quad tendon grafts. But yeah, those are some of the pros and cons of a quad tendon graft. I personally think that as research becomes more robust, that we will see more quad tendon grafts compared to hamstrings. I think that whenever you can when you don't have to take away knee stabilizer, especially from a young athlete, they're going to try and not do that. So I think as more research catches up, I think quad grafts in a sense will replace hamstring grafts, especially in the adolescent population. So yeah, it's definitely something I've seen more of. Just again, think about the pros and the cons when you're talking to patients about graft selection if they come to you for that. Also making sure you're working in that deep knee flexion, that deep loaded knee flexion to work on that knee extension in different angles. So yeah, hopefully you guys found this video helpful. Let me know if you have any questions. Thank you for watching today's video. Please feel free to like and subscribe. I have started an ACL Mastermind group, which is a program designed for physical therapists, physios, strength coaches, students, and athletic trainers who want to learn more about ACL rehab. It currently holds over 600 videos and has over 500 members with new videos added every single month. The videos cover immediate post-op to late-stage sports-specific movements and everything in between. Content specifically also includes rehab complications, treatment philosophies, case studies where you can see my real-life patients, movement assessments, exercise breakdowns so you understand how to properly teach the exercises. The exercises are also arranged by difficulty level for strengthening exercises, plyometrics, balance, and neuromuscular control. Of course, it also covers late stage for movement exercises from structured all the way to randomized and chaotic to mimic more sports-related settings. And lastly, you also learn how to do return to sport testing, which is extremely important, and this what ultimately determines whether or not someone is safe or not safe to return to sports again. There's also questions within the group where you can learn how I engage with patients and their parents of how to answer difficult questions throughout the rehab process, which is inevitable to come up. And lastly, you gain access to a private forum where you can ask questions directly to me and others within the community. We share research articles, we share other equipment and beneficial equipment and things like that. Anything that can come up within the ACL rehab spectrum, that's when you can ask within the private forum. And lastly, you can also download the app where you can gain access in your respective facilities directly on your phones. If you have any interest, please feel free to click the link below, and I appreciate you watching today's video.